And when you look at the opioid crisis, what do you think is something, what will help that? What do we need to do?
Yeah, in a way, the opioid crisis is first, it's something our country should be quite disappointed that we allowed to transpire, because essentially we've systematically poisoned our population in a way in terms of the mass consumption of opioids. But if you step back, it's another example that reinforces we try to answer problems with interventions. So have a problem, have an intervention, as opposed to more comprehensively help individuals manage pain. So stepping back, we consume the vast majority of the world's pharmaceutical opioids for 5% of the world's population. That doesn't really make sense. As a company, we stepped forward about 2.5 years ago and said we're going to reduce the consumption of pharmaceutical opioids by 25% for our customers, working hand in glove with physicians to bring the consumption back to pre-epidemic levels. And we sought to do that in 3 years. I'm proud our company did it in 22 months. And now we stepped forward and said in cities around the United States, we're stepping forward with a pledge to reduce the rate of opioid and overdose related deaths by 25%. And the way you do that is one person at a time and working hand in glove with medical professionals and community leaders. So to me, it's a problem that is really symptomatic of an overconsumption of health services unnecessarily and not addressing the whole person in coordination with the physician. And the bright spot is when you work collaboratively with the physician and the individual, you could move the needle forward, and I'm proud of what our company did.
And how do you do that on such a large scale? Because like you said, it is a very one-to-one thing.
Yeah.
And how do you create an incentive to not just to reduce the number of prescriptions without hurting people?
Yeah, I know, a really important and powerful question. So when you're a large corporation, no matter what industry you're in, the risk is that you kind of come at things in a homogeneous way. We believe everything is local. All healthcare is personal, all healthcare is local. So we operate a very localized model, aided by global resources. So the engagement happens with the local practicing physician, with our physician leaders, talking hand in glove with those individuals. It comes with convening community leaders, faith-based leaders, employers, elected officials locally, because the solution in community A is different than the solution in community B based on the local orientation. And in fact, our strategy is go deeper, go local, go beyond. So we're quite serious about that localization in terms of the personalization, the engagement at the local level and trying to drive it, but it's with the clinicians, not to the clinicians, and it's with the consumer or patient, not to the consumer or patient.